Hi, I'm Michelle, and I've been leading a class series on the wood element for the spring season. We've been talking about the liver and the gallbladder and their roles physically, mentally, and emotionally. And last week we talked about the causes of liver disharmony. And then today we're going to talk about what those patterns of disharmony are, or common patterns of disharmony for the liver. So just to quickly recap from last week, certain things that can be causes of liver disharmony include poor diet, diets low in nutrients that enrich the blood. GI disorders may also play a role in this, in hindering proper absorption. So that's one major cause of liver disharmony, which the blood has a big, the liver plays a big role with blood. And then severe blood loss, obviously, hemorrhage can lead to problems for the liver, as well as overexertion. So long-term overexertion physically can deplete the liver, and then emotionally, anger is the emotion that is most damaging to the liver. So repressed anger can hinder the liver as well. Chronic stress. So those are some elements, some factors that can really damage the liver. And then lastly, the climate associated with the wood element is wind. Windy climates can perhaps exacerbate underlying conditions and contribute to patterns of disharmony for the liver. Also hot and humid climates, or long-term or repeated exposure, as well as cold, excessive cold, can also contribute. So we'll dive into what the patterns of disharmony actually are for the liver. So both deficiency and excess patterns, as well as mixed excess and deficiency patterns. So to start, we'll talk about some deficient patterns, which the major ones are for the liver: blood and yin deficiency. So blood deficiency is kind of like a milder form of yin deficiency on a spectrum from yin to yang. We've got those two at the extremes, yin and yang. And so you can have both yin and yang deficiency. For the liver, you really never hear about liver yang deficiency. It's the yin. And then qi is more on the yang side, and blood more on the yin side. So blood deficiency, the signs and symptoms that go with that are kind of a milder form of the yin deficient signs and symptoms. So for blood deficiency, it can look like it's like you're not fully present, because our blood is seen to hold our consciousness from a Chinese medicine perspective. So someone who's kind of not filling up their space, they may be a little restless or a little anxious, maybe dizzy or prone to like postural hypotension, where there's like a kind of moment that it takes to the vision to clear when you stand up, or when you've had your head hanging down and stand up. Also, certain signs of dryness can go along with blood deficiency. That lack of, fluid. And the nails are associated with the liver, as we talked about in an earlier class. So you might see like some brittle nails with blood deficiency. Also, the eyes are associated with the liver. So blurred vision, poor vision, floaters in the eyes can be due to liver blood deficiency. Also, the liver plays a big role in menstrual cycle. And so a lack of a period before menopause, or like a very light flow, could be due to liver blood deficiency. Cramping after you start your period, and you're starting to lose blood, is also a sign of liver blood deficiency. And certain kinds of insomnia, particularly trouble falling asleep, is a sign of a lack of blood deficiency. So yeah, the blood, having sufficient blood allows us to be really present, and then also allows us to be deeply restful. So having difficulty with that can point to blood deficiency, and you may have some kind of like joint stiffness or numbness just from a lack of that sufficient blood nourishment, as the liver is associated with our joints, in particular our sinews. And for tongue and pulse, we'll just briefly cover, and if you want to get more into tongue and pulse qualities, you can check out my videos on those. But for liver blood deficiency, the pulse will feel thin, and the tongue may also look thin and be pale. Also, the complexion might be pale and kind of dull, like lusterless. And so from a kind of a Western perspective, conditions that might be associated with blood deficiency on an extreme would be anemia. So you don't necessarily have to have anemia to be blood deficient. Anemia is kind of the far end of the spectrum. Certain types of insomnia, as I said, amenorrhea or lack of menstrual cycle before menopause. So then moving on to liver yin deficiency. So those signs and symptoms, but more severe. And you might also start to see what's called empty heat, with this lack of, like, you can think of yin as like the coolant in our body, the fluidity, the capacity for restfulness. So a yin deficiency is like a deep, can be kind of a deep dehydration, can go with a lot of signs of dryness and a deep lack of restfulness, and signs of empty heat, which is in Chinese medicine, there are true heat conditions or full heat conditions where we're not going to get into that right now, but empty heat would be things like hot flashes, where you're constitutionally not hot or necessarily have the kind of inflammation associated with true heat, but it's more like that lack of coolant in the body that then is giving rise to this temporary feeling of heat. Could include like irritability, Again, restlessness, like with blood deficiency, but yeah, more tinged with like an irritability. Insomnia that is, you may be exhausted enough that you can fall asleep pretty easily, but then the sleep is not deep or restful. You're waking up, you're tossing and turning, you're not refreshed when you wake up. The hours between 1 and 3 a.m. roughly, depending on the time of year, are the times associated with the liver. So not necessarily you'd be waking at that time, but if you're always waking at a particular time, it's good to note the organ associated with that time. So if you're always waking within that window at the liver's, what should be the liver's peak functioning, it could point to a liver disharmony. Again, you might have vision issues, dry eyes, tinnitus or tinnitus, that ringing in the ears. In particular for liver yin deficiency, it'd be like a high-pitched ring. Night sweats, hot flashes, thirst. You may be thirsty, but you don't really like feel like drinking a lot of water. It's more like just feeling a dryness, or you just might like to kind of sip frequently on something. And again, with the menstrual cycle, it may be very light, it may be completely absent before menopause. And the tendons, the joints might be kind of weak, stiff, perhaps numb. And the tongue and the pulse, briefly, the tongue is, with yin deficiency, it's going to be cracked, so perhaps a crack down the middle of the tongue, and it might be red, sign of that heat, and maybe kind of narrow, from a lack of like juiciness, and blood to fill it out, and it may be kind of dry looking, and the coat is going to be either partially or fully peeled, so kind of just like a raw looking cracked tongue, and the pulse would be thin and kind of hard, or what's just called tight, and perhaps rapid, which is a sign of that heat. So this may be a cause for high blood pressure. This could also often, these signs and symptoms go along with menopause. Also, as I said, insomnia with trouble staying asleep. So those are some kind of Western conditions that may go along with liver yin deficiency. So those are the two major liver deficiency patterns. And now we'll move on to the excess liver patterns. So on the most mild end is liver qi stagnation. Very common, particularly, I'm told, in American culture, I guess compared to other cultures. So stress is usually a sign of, or a cause or a result of liver qi stagnation. Aches and pains that aren't severe, that kind of are hard to, you can't necessarily pinpoint where it is. It might kind of move around a little bit, and it's usually any symptoms with liver qi stagnation are going to be helped with movement, with exercise, to kind of get that qi flowing. And this may, on an emotional level, look like moodiness. It may look like depression. Again, depression that's like alleviated by or helped by exercising, because it's really just like this stuck emotion. There may be kind of pent up frustration or repressed anger. There may be, like, particularly in the diaphragm area where the liver meridian ends, this stuckness and a lot of like sighing to kind of express without really directly expressing your frustration. Yeah, there may be kind of a feeling of fullness or even pain, like under the rib cage. And again, menstrual cycle might be kind of off, like the regularity of it may be thrown off. This is a condition, plum pit chi is a condition that's a combination of liver chi stagnation and phlegm. But just briefly, that's this feeling of like something stuck in your throat that you can never kind of like swallow or cough out. It's just like there's always just this like stuck feeling from this phlegm, and usually from kind of just like swallowing your words and repressing your feelings. So that's a very specific kind of liver chi stagnation with phlegm. You may also, there may be an interaction with the digestive organs, resulting in nausea, fluctuating between diarrhea and constipation, and usually worsened by stress. In addition to irregular period, you may also have like premenstrual tension, just like a worsening of kind of a worsening of symptoms before your period, breast tenderness, and the tongue and pulse associated with liver chi stagnation. The tongue may just look normal. It may be kind of red on the edges. It may have a sort of, it's called dusky, like this pale bluish tinge to it. The whole tongue, the veins under the tongue may be kind of bluish looking, not thick or distended, just thin and blue. But again, it may be just no real signs of this on the tongue, as it's a really kind of early stage pattern of disharmony, very common. But the pulse will feel wiry, particularly the liver pulse. So this like kind of tight, taut feeling like a guitar string, like almost vibrating. From a Western perspective, this may be associated with conditions like premenstrual disorder, or different menstrual disorders, or just irregularity, and IBS perhaps, and just kind of like muscular tension. So again, very early stages of a pattern. And then this pattern, if left kind of unchecked, can lead to more severe patterns, for example, liver blood stasis or stagnation. So with blood stagnation, it's there's usually pain that is severe. So different than the chi stagnant pain, this pain is like, you need this gone immediately. You can usually specifically point to exactly where the pain is. It's fixed, it's sharp, it may be stabbing. There may be palpable masses with blood stagnation. There may be signs and symptoms, again, with like the nails and the complexion that would be With blood stagnation, it's going to be dark, like dark, maybe purplish. The tongue will be purplish, and there may even be darker spots on the tongue. The pulse is a quality called choppy. And again, if you want to know more about that, you can check out my video on, or videos on pulse diagnosis. With the menstrual cycle, pain before the period in particular is a sign of liver blood stagnation. So once you start bleeding, you may feel relief. So once something is leaving the body, if you feel relief, that's a sign of an excess pattern. But you may feel cramps before and during the period, so there's signs of liver blood stagnation and blood deficiency. So these patterns can and often do overlap and kind of create a vicious cycle. And also with the menstrual blood, it may be dark. It may have clots in it, like big, kind of bigger than a pea in size. The skin may be kind of rough and dry, scaly, and the complexion, the lips and the nails may also be kind of dark. So this could be associated with conditions like enlarged liver, hepatomegaly, chronic hepatitis, liver fibrosis, cirrhosis. So not necessarily, it might be a combination of different patterns that we'll talk about momentarily. Moving on to some other patterns that are also excess, and that may be a combination of different patterns. We have liver yang rising, or on a more severe level, liver fire blazing. So liver yang rising is usually precipitated by liver qi stagnation, that milder pattern we were just talking about. And with both the yang rising and the fire blazing, as the name suggests, there's like this upward surging of energy. The fire blazing, there's more signs of heat, inflammation. There may be more intense emotion, rage. With the liver yang rising, it may be more like irritability, and like the liver yin deficient signs. So oftentimes the liver yin deficiency also is a early stage of liver yang rising. This can be associated with headaches, particularly like around the temples and the top of the head. It can also be associated with tinnitus or tinnitus, again, that high-pitched ringing in the ear. With the fire blazing in particular, maybe a red face, red eyes. So a lot of like signs and symptoms in the head, representing this rising energy. There may be a bitter taste in the mouth. Bitter taste, usually something to do with liver gallbladder disharmony. Again, insomnia, maybe dizziness, and the tongue, particularly for fire blazing, would be red, sign of heat, as well as like a yellow coating. And the pulse, again, would be wiry and also rapid as a sign of heat if there's fire blazing. So this might be seen as tension headache, or just like various signs of inflammation from a Western perspective, high blood pressure, You know, untreated high blood pressure could result in headache, dizziness, vertigo, fatty liver disease. So again, like we talked about the potential causes of liver disharmony, this could be from a combination of like excessive consumption of like poor diet, fatty, greasy foods, maybe excessive alcohol consumption, especially with like heat signs. Alcohol tends to be really warming. And it could be compounded with repressed anger, chronic stress, perhaps being sedentary. So just all this like stuck, stagnant chi and depletion of yin can lead to this, like there's not enough yin to root the yang, and then this energy surges upward, causing these different symptoms. Let's see, lastly, we'll talk about damp heat in the liver and gallbladder, which previous class we talked about damp heat in the gallbladder, so pretty much the same pattern as that. So signs of damp heat, this could include a variety of different things, fever or alternating fever and chills, nausea. It could be a yellowing of the eyes and the skin, so jaundice. Again, there may be a bitter taste in the mouth, a feeling of fullness or pain in the hypochondrium, below the rib cage. There may be genitourinary signs and symptoms. The liver meridian goes around that area, and so damp heat in the liver could lead to like swelling, itchiness, discharge from the genitals. So a variety of different potential issues could be associated with liver and gallbladder damp heat. The tongue would be red, again, heat, and the coating would be yellow and kind of like sticky looking. The pulse would possibly be both wiry and slippery, indicating dampness, as well as rapid, indicating heat. So a lot going on. And again, this could be associated with jaundice, could be associated with inflammation of the gallbladder, gallstones, hepatitis, fatty liver disease, or it could be a bacterial infection, like if it was like a genitourinary symptoms due to a bacterial infection. So that covers it for the major patterns of liver disharmony that you might see, and so ways to kind of support and help the liver, of course, practicing Qigong to get the Qi flowing in a way that is nourishing and supportive, calming, hopefully, eating a good nutrient-rich diet. We talked a little bit about that in the last video if you'd like to check that out. And yeah, just making ways to reduce our stress and developing good sleep hygiene to ease ourselves in for the night so that we're readying our bodies, our liver, to store the blood rather than it being stuck out in the periphery, causing restlessness,